हेलो व्यूअर्स, वेलकम टू हेल्थ शो गाइड। तो आज हम बात करना चाहते हैं गैस्ट्रो इंटेस्टाइनल डिसऑर्डर्स की। गैस्ट्रो इंटेस्टाइनल डिसऑर्डर्स दो तरह के होते हैं, एक तो फंक्शनल डिसऑर्डर्स, नंबर टू हो गए स्ट्रक्चरल डिसऑर्डर्स। तो टुडे वी आर टॉकिंग अबाउट इरिटेबल बाउल सिंड्रोम, जो कि एक फंक्शनल डिसऑर्डर है जीआईटी का। अब इरिटेबल बाउल सिंड्रोम जो भी है, इसमें कुछ सिम्टम्स हमें नजर आते हैं। व्हाट आर दो सिम्टम्स? देयर इज कंटिन्यूअस एब्डोमिनल पेन फॉलोड बाय ब्लोटिंग एंड कॉन्स्टिपेशन. Constipation is a problem, pain is a problem, then it is also followed by diarrhea is a problem, flatulence. Naturally there is loss of appetite followed by nausea and headache. There are other issues also, appearance of mucus in stools accompanied with no doubt lethargy, accidental bowel movements, and there are issues in maturation also. Now, what is the pathophysiology? Pathophysiology is not clear. We don't have a clear-cut cause of this irritable bowel syndrome. So many theories have been put forward, but it is being considered that there is alteration of gastrointestinal motility. Secondly, there is visceral hypersensitivity, that is increased sensation in response to stimuli. Thirdly, there is no correlation between brain and gut axis. There is alteration in communication between enteric nervous system and central nervous system. And lastly, there is issue of post-infections. Now, there are different types of irritable bowel syndrome. First of all, we have irritable bowel syndrome accompanied with constipation, IBS-C. Secondly, we have IBS accompanied with diarrhea, that is IBS-D. And next, we have IBS, that is mixed bowel habits, that is M. Now, what are the causes? The cause is dysmotility, means you have problems with how your GI muscles contract and more food through GIT tract. The colon, that is large intestine muscle, tends to contract more in people who suffer from IBS. So what we conclude is there is tremendous contraction of gastrointestinal muscles, especially in the large intestine. These very contractions cause cramps and abdominal pain. Secondly, we need to talk about visceral hypersensitivity, means there is extra sensitive nerves in GI tract. People with IBS have a lower pain tolerance than people without it. And lastly, we have digestive tract, whatever it is super sensitive to abdominal pain or discomfort. There may be other potential issues also, for example, gut bacteria. Research has shown that people with IBS have altered gut bacteria. They contribute to symptoms. Secondly, there is severe infections also. Some people get diagnosed with IBS after a severe infection affecting GI tract. Food intolerance is another cause. Sensitivities or allergies to different foodstuffs may contribute to IBS. And childhood stress is also an auxiliary cause. People with IBS are more common in people who have experienced severe stress in childhood related to physical or sexual or emotional abuse, etc. Now, what is the treatment? First of all, we have to change our meal. Increase fiber intake in our diet, because fiber will give you relief from constipation, and we have to limit dairy products also like cheese, milk, etc. And treatment with drugs, pharmacological therapy, antidepressants would be a possible solution. Incorporating fiber and fiber supplements, incorporating laxatives, antidiarrheals, medication to help with intestinal spasm. Probiotics can be of great help in IBS. Now, these are certain foods like fish, green vegetables, non-stress fruits, rice, brown bread, yogurt, cereals, pasta, bran, bananas. People with IBS need to incorporate more in their diet, and people who should not take spicy fruits, citrus fruits, cheese, onions, and nuts, beef, or you can say this red meat, eggs, dairy products, and coffee. They should not eat it in excess. So thank you. Thanks for watching.